Hello, it's Mrs. Straight Talking Orthodontist again. I decided today I'm going to talk a little bit about Invisalign and Invisalign attachments in particular. It's something that we get a lot of questions about from patients when they are thinking about Invisalign or starting their Invisalign process. And I find it really useful just to explain to patients kind of why we have attachments and what they're for. So let me just show you a couple of, I'm going to show you an example. If I just turn the little video around. So if we look at this example here, you can see that we've got a couple of attachments on the different teeth here. This is just a sample one that I've picked up off the Invisalign site. And this kind of thing obviously generally will freak people out a little bit when they see that there's a number of attachments on, particularly if they're any near the front of the mouth. Now, just to sort of explain about Invisalign and kind of how it works. Generally, when they first started using clear aligner systems for straightening teeth, what they found was about 40% of what was programmed into the actual treatment was achieved. And so when they went back and reviewed the results and tried to work out why it wasn't working, one of the key things they found was that the aligners actually were lifting off of the teeth rather than moving the teeth. So the attachments first and foremost are actually to hold the aligner on the teeth, and that means that the energy that's stored in the aligner is then actually transferred to the teeth and makes the teeth move. Now, various different types of attachments have been trialed by companies such as Invisalign, and I have to say for Invisalign they do put a huge amount of research and development into their system. So it's getting better and better and better and better all of the time. And you don't necessarily get that with every aligner system. I just want to make that clear. Now, if we go back to our little picture here, I'm just going to turn the screen around again. If we have a look at what we've got going on here, let me take that up a little bit for you. If you look at these types of attachments here, they're all very different, and actually the key thing about any setup with Invisalign is that it is completely individualized to every single patient. So you can't predict where attachments necessarily going to be for a patient until they've had their setup done and you can get in front of them and talk to them. So these type of attachments are actually called optimized attachments, and in Invisalign speak that basically means that there is a particular movement that tooth needs to do, and that movement is a little bit challenging maybe, or is a little bit less predictable just with the plastic on its own. So those attachments are actually physically doing some of the tooth movement as well as the plastic of the aligners. And so for a successful aligner treatment, my belief is that if you don't have the attachments on the teeth, you are not going to get the movement programmed in. So it's never a question for me when patients come in, if they say, oh, do I really need to have the attachments? I don't like the idea of them. The answer is yes, you can have them taken off, but you're only going to get 40% movement. So the reality is if you want your teeth to move as well as they would do with a train track brace or a fixed brace, then if you're going to have Invisalign, you must have attachments on, okay? It's not really negotiable. And I hope that kind of really helps people understand why we have them and why they're important. I would be seriously concerned if I had a patient come in and they didn't have any attachments on any of their teeth when they're starting Invisalign. So if you're going to go through this process and you're having Invisalign, and you don't have any attachments, that should only be because you've got very tiny movements that need to be achieved. If you've got big movements and you've got no attachments, you are going to have lots and lots of extra sets of aligners to get the result, because it won't happen without the attachments. Okay, so I hope that's of help to you. Have a great day and keep smiling.